All right, let's talk about an organism that's living in most of our throats right now. One we almost never think about, Neisseria sicca. But don't let its commonness fool you. This bug is a master of disguise, a classic story of a dual identity, and today we are going to pull back the curtain and reveal its secrets.
So, what's the real story here? Is Neisseria sicca just another quiet neighbor in our oral microbiome? Or is it a hidden threat, an opportunist just waiting for the right moment to strike? That's the core question we're going to tackle.
Now, to put this all together for you, we've synthesized a whole lot of clinical and microbiology literature. For those of you who really want to get into the weeds, the full list of our primary sources is right there in the accompanying notebook document. So let's get into it. We're going to start with a genuine identity crisis. For years, we thought we knew Neisseria sicca based on what it looked like growing on a plate, but modern genetics is telling a very, very different story. Okay, check this out, because this is where it gets messy. In the lab, for decades, we've spotted this gram-negative Diplococcus by its classic colony, dry, wrinkled, sticks to the agar. It's right there in the name, Sicca. But its genes tell another story. A lot of these isolates, they're actually just a weird-looking version of Neisseria mucosa. This is a huge deal. It means our entire historical understanding of this bug's ability to cause disease could be built on a case of mistaken identity. And this is where modern tools just blow the old ways out of the water. High-res methods like cord genome MLST are finally cutting through all that confusion and redrawing the family tree. The takeaway here is crucial. You can't always trust your eyes. Definitive ID really demands genomics to know exactly what you're dealing with. So this identity crisis isn't just some academic puzzle, right? It has massive clinical implications. How does a bug that's normally just hanging out in your throat suddenly cause a life-threatening disease? Well, the answer isn't really about the bug itself. It's about us. It's about our own vulnerabilities. You see, Neisseria sicca is the ultimate opportunist. It just waits for our defenses to drop. The biggest risk factors are pretty clear. Severe immunocompromise, like in patients with HIV or on long-term steroids, having foreign bodies, like prosthetic heart valves or shunts, and, this one's really key, terminal complement inhibition. Patients on drugs like eculizumab are at a much higher risk. That tells you that in a healthy person, the complement system is what's keeping this thing in check. And when it does break through, the results can be absolutely devastating. Infective endocarditis is the complication we fear most, with more than 27 cases in the literature. It can be sneaky, but it carries a huge risk of throwing clots everywhere, leading to things like strokes and abscesses. Finding Neisseria sicca in a blood culture is never, ever something you just ignore.
And the danger doesn't stop with the heart. This organism has a surprisingly nasty bag of tricks. We've seen it cause meningitis after neurosurgery, wicked pneumonia in patients with already damaged lungs, deep bone and joint infections, and even a super-aggressive conjunctivitis that can look a lot like gonorrhea. It's a versatile and dangerous pathogen when you give it an opening.
Okay, so we have this organism that's tough to identify, and it can cause really severe disease in vulnerable people. This leads us straight to the next huge challenge, the massive void we face when it comes to diagnosing and treating. This technology gap is a real headache for clinical labs. Our standard rapid ID methods, they're just not reliable for these commensal Neisseria. MALDI-TOF often gets it wrong, and 16S sequencing just doesn't have the resolution to tell these close cousins apart. The definitive methods, like whole genome sequencing, are way too slow and expensive for routine work, so we're stuck in this dangerous diagnostic gray zone. And let's say you do get a confident ID. You immediately hit another brick wall. This quote says it all, perfectly. There are no formal evidence-based treatment guidelines, not from the IDSA, not from ESC-MID, not from the Dutch SWAB, nothing. You are essentially flying blind. So in this guideline vacuum, what's a clinician supposed to do? We have to fall back on case reports and, most importantly, susceptibility testing on the actual isolate. As you can see, third-gen cephalosporins like ceftriaxone are the workhorse, often for weeks at a time. But here's the absolute bottom line. You must have a susceptibility report. Resistance is a real worry. And to make it even harder, EUCAST hasn't set any official breakpoints, so you get an MIC value that you have to interpret with a lot of clinical judgment.
And if you think the data is thin for adults, for kids, it's practically non-existent. So in the real world, pediatricians often have to extrapolate using guidelines for the more pathogenic Neisseria. For example, The CDC's weight-based ceftriaxone dosing for serious gonococcal infections is a pretty reasonable place to start, but always, in consultation with a pediatric ID specialist.
All right, now we get to what might be the single most important public health point of this entire explainer. It's not just about the rare, nasty infections Neisseria sicca causes. It's about its role as a silent, hidden reservoir for antimicrobial resistance.
I want you to picture the back of your throat as this bustling marketplace for genes. And in this market, Neisseria species are the most active traders. They are what we call naturally competent, which means they can literally just grab floating bits of DNA from their dead neighbors and stitch them right into their own genome. This is the engine that drives evolution for the entire genus, and it's how resistance can spread like wildfire.
And here's where it gets really scary. We have overwhelming evidence that these harmless commensal species, like Neisseria sicca, are the original source for resistance genes that eventually end up in Neisseria gonorrhea. The textbook example is the mosaic Pen-A alleles, the ones that give gonorrhea resistance to cephalosporins. Those genes were built from spare parts donated by its harmless relatives. This makes the entire commensal Neisseria population a canary in the coal mine. They're a leading indicator. The resistance that we see bubbling up in them today could very well be the superbug resistance we're fighting in Neisseria gonorrhea tomorrow. And that really suggests we need a fundamental shift in how we think about surveillance. Okay, so let's tie this all together. How do we manage this complex, modern threat in a practical, clinical setting? It all comes down to being smart and context-aware with our infection prevention. Your IPC strategy has to be flexible. For the vast majority of patients where Neisseria sicca is just normal flora, standard precautions are all you need. But if you isolate a multi-drug-resistant strain, you've got to escalate to transmission-based precautions to stop it from spreading. And for that really high-risk, immunocompromised patient, the whole game shifts to preventing an endogenous infection through absolutely meticulous aseptic technique during any procedure.
Which leaves us with this final, massive question. Bugs like Neisseria sicca are forcing us to completely rethink these old, neat categories. If the line between a harmless bug and a deadly pathogen is this blurry, and if these harmless bugs are the breeding ground for the next wave of resistance, how on earth do we evolve our surveillance strategies to actually stay ahead of the curve?
Look, this is a story that's still being written, and it's a lot to take in. If you want to dive into the research and the case reports that shaped this whole discussion, you'll find everything you need in that accompanying notebook document. And that is our deep dive into the complicated world of Neisseria sicca. Hopefully it's given you a whole new way to think about this deceptive organism. If you found this useful, do us a favor and subscribe for more explainers like this one. And we would genuinely love to hear your thoughts and experiences in the comments below. Thanks so much for joining us,